Welcome, everyone. It looks like we're going to have a very big audience today. I see a lot of people are starting to trickle on now. So I wanted to go ahead and just say thank you to everyone who is making time out of their new normal and super busy schedules to spend a little time with us and learn about what it means to you to be forever young. Before I introduce myself, I just want to bring up a couple webinar technical things. Although we won't be able to see your beautiful faces or hear your voices during the presentation, we still encourage you to communicate with us by using the Q&A and chat box that is at the bottom of your screen. The Q&A section is a great place for you to enter questions as we move through the presentation, so that we can answer those at the end during our Q&A session. And then the chat box is a fun place for you to add comments as we move through, and we might have a question for you as well. So if you haven't met me yet, my name is Allison Crater, and I am the Non-Surgical Business Development Manager here at the Piazza Center. And I'm still fairly new in the role. I started in January, but I was a patient for almost 5 years before I took this role. And I can say I had many amazing outcomes with my treatments and enjoyed a lot of fantastic customer experiences as a patient. What I didn't know when I was a patient was how much education really goes in behind the scenes with our staff and providers and doctors. They are always learning new things so that they can be the experts in their field. The other part of my role is to be an extra layer of support for all of the patients. So just know that I'm here for you. I love to hear from you, either voicemail or email, or let me know when you come into the office so I can come say hi in person. And if you ever have any questions, please let me know. I am happy to answer them for you. So I want to move into our topic of the day and start with our very big question. What does it mean to you to be forever young? Is it a feeling or is it a look? And I encourage you guys to use the chat box at this time to put your answers in. I'm going to open this up and see some answers for you. Dr. Piazza, can you turn your screen off? Here we go. So, slow down or reverse the aging process. Yes, that's a great one. I mean, for me, that is what it's all about. Every time I look in the mirror, I want to reverse the signs of aging by 10 years automatically. And for me, that's more about a tightening of the skin or adding some more volume. I've got someone saying less wrinkles. Yes, those pesky fine lines and wrinkles are a big one for everyone. Maintaining a healthy, glowing skin. We're going to see some before and after pictures in this presentation that are going to blow your mind about the movement from more of a dull look on your skin to that beautiful, glowing skin. You're just going to love that. What else? Does anybody else? Oh, to recognize yourself when you look in the mirror? Yes, I feel the same way. I feel like if I could not be surprised every time I look in the mirror and wish that I could just pull everything back up, that would be amazing. No brown spots, no red spots. We get a lot of calls about sun damage and removing those red and brown spots. Those are definitely big ones. Thank you all so much for sharing. So we are going to, at this point, pull up our presentation again. And I'm going to introduce you to our panelists. So Dr. Piazza, he is our board certified plastic surgeon who specializes in breast and body for men and women. He is from Austin and has been practicing for over 9 years. And he was recently named the #1 plastic surgeon for breast implants by volume in the Austin and San Antonio area. And we are super proud of him for that. Dr. Antunes is our double board certified plastic surgeon for face, and he has over 15 years of surgical experience and has performed over 5,000 facial procedures. The wonderful thing about these guys, not only are they such amazing surgeons, they are especially passionate about skincare and our laser services. I also want you to meet our other amazing providers. Our advanced nurse injectors are Haley Pena and Allison Kothman, and together have performed tens of thousands of expert injections over their careers. And Jennifer Schechter is our medical esthetician, laser tech, and expert skin coach. So hopefully you guys will be in and able to see them at appointments very shortly. So are y'all ready to get started? I hope so. At this point, I will turn it over to Dr. Piazza, who is our first presenter.
Thank you so much, Allison. It's so nice to be here today and to be able to do this with you guys. So we put together a pretty aggressive course, but we think this we think this is going to be an awesome topic to cover, and so we wanted to make sure we're really kind of hitting everything. So here we go. First, what does it mean to be forever young? We did some work around this a little bit earlier and defined what this means for us today, and we're going to go over that. What are some of the DIY do's and don'ts? We've seen a lot of stuff in the media about things that you can do, but should you do it? An overview of broadband light therapy. We're going to do a deep dive into HALO Hybrid Fractional Resurfacing, and we're going to talk about the latest in elastin boosting technology. This is some really cool stuff today, and we're excited to show those slides to you. And then our Forever Young annual skincare program. We've been in the practice of transitioning our skincare programs to more of an annual vision, and what we've done in order to ensure that's going to be in your best interest. So I'd like to get started and really go through that definition of what does it mean for us to be forever young. Some of the things that we heard were look and feel youthful, recognize myself when I look in the mirror, having great skin, radiant skin, glowing skin, really not wanting saggy skin. I think exuding confidence or having that inner self-love that has an outward appearance is right on target here. You know, we've got to really love ourselves in order to really appreciate the improvement in our skin with treatments too. So that's very, very important. So we want you to feel energized today with this talk. We feel that defines forever young. And so we're going to go ahead and get started. So what should we really be doing, right? So we've gone through some DIYs and we really chose what are the don'ts and what are the do's. So the don'ts. Performing your own extraction is a big don't for us because many times you can do damage to your skin or cause a blemish or a whitehead to actually increase the degree of inflammation and worsen the outcome for you. That's what we're here for. Don't use essential oils in your skincare routine. There have been studies that show that a lot of these complementary and alternative types of medicine practices don't have consistent ingredients in them. So you don't really know what you're putting on your skin. So we want you to focus on medical grade skincare. Don't exfoliate every day. This actually can be quite damaging to the skin. The skin's in a constant process of cell renewal and turnover. Exfoliating a few times a week is awesome. Exfoliating every day is too much and too aggressive. If you've got this in your shower and you are using this on your face, please, please do yourself a favor and stop this now. Very important. This has no place in our facial skincare routine. Also, be aware of what you're buying online. Not all products are medical grade, and we really want to know that we've done a ton of research on selecting the best skincare products possible for you. And we have those available in our practice. And if you want to run something by us, I saw this and I'm worried, I think this might be a great product, just ask us. That's what we're here for. And don't trust every Instagram celebrity. While they are fun to watch, many of the times they don't always recommend something that's actually in your best interest. It's in their best interest with regards to dollars in their Venmo account. So what can you do? The do's. Use a quality cleanser when you wash your face. This is really important, and it's important to wash it twice a day. Toning pads can be very helpful at keeping a good pH balance to the skin, and we're a big fan of this. Using quality at home masks to brighten or detoxify your skin 1 to 3 times per week. Black Mask by Revision Skincare, which is formulated in Dallas, is an excellent, excellent mask. Exfoliating 1 to 2 times each week using medical grade proven product like the Zeo exfoliating polish. This is actually magnesium oxide crystals. It's gorgeous in color. It feels incredible as far as exfoliating routine. This is something that can be done a few times a week. It's amazing. We highly recommend this. And then of course, UV blocking sunscreen. Elta is an excellent brand. So are many other brands, but physical blocking sunscreen should have an absolute role in your daily routine. And when we look about skincare and thinking about what you're doing on a daily basis, this is important that you're diligent with your at-home medical grade skincare routine. We moved to this process earlier this year and looking at cleansing, nourishing, brightening, moisturizing, and protecting our skin, and then what you can do at home. And then creating your 12-month plan. This is something that I would love the opportunity to go over with each of you and customize a plan, because we truly want to be your performance coach for your skin. So we all age in our own way, and we've seen this with a number of celebrities, and we truly think in many of these instances, Sciton treatments could and can help. So what is it about HALO and BBL? Well, let's first talk about BBL, keeping us forever young. We've heard that multiple times today, but why is this true? Well, let's start kind of at the very beginning and talking about light. We love light for the most part, right? The sun makes us go outside. We want to be on the boat or at the beach or at the pool, especially in the summer months. And why is this? Because there are positive effects. We know that vitamin D and calcium absorption are a big part of this. It improves our sleep. It's a mood enhancer, and it can help when it's too cloudy and gray and we don't feel so good, right? We have that seasonal affective disorder. The negative effects are DNA damage, oxidative damage. This destroys the collagen, the hyaluronic acid that are components of our skin. It's harmful to our eyes. It definitely can cause skin cancer. We know that, and wrinkles over time as well. So when we look at BBL, here's a little bit more about this technology and why this is important.
BBL optimally delivers infrared and visible light, penetrating through the epidermis and dermis, stimulating changes at the molecular level and visible changes in the dermis. The gene expression of older, damaged skin cells changes and will more closely resemble the genes expressed in younger skin cells. These genes are involved with aging and longevity, and many are associated with increased lifespan. The cells are reinvigorated, and over time, the skin looks much younger. There are visible improvements in skin firmness, elasticity, and pigmentation. With regular BBL treatments, the skin is clear, smooth, and more youthful.
So when we talk about light, we pretty much see visible light, right? But the light spectrum is huge, from gamma rays to radio waves. And so when we're focusing on light, what you have to think about for BBL or broadband light is that it's filtered. We're filtering out all the stuff that's not going to make a great difference for you. We are choosing selectively what's going to cause change in your skin, so we can target brown spots and hair follicles and things like that. So when we're looking at spider veins, we're using a certain part of this wavelength of light to target spider veins. And we are looking at a certain part of wavelength of light when we're targeting brown spots, and the same thing with unwanted hair. And this allows us to be very strategic in our treatment for you. So when we're looking at some results, I want to show you this one. I think this is an amazing result. This is 2 weeks after one treatment with broadband light. And you notice a lot of things that are going on. Collectively, I think we all can agree that we notice she's got a glow. The skin reflects off of her, the light rather reflects off of her skin. And she's got this radiance that's there. The brown spots that were present here on the forehead and the cheeks, those have been basically, they're gone. And they create a brighter complexion, a more youthful complexion. Because as we age, we see that our skin, especially when we look in the mirror, is not as bright as it was once before. It becomes dull. And that's the last thing we want for our patients. When we look at the area of the décolleté, often an area that's neglected. And it's an important area to treat, just like the surface of the hands, because you don't want to have a mismatch. Many of my patients will invest in breast surgery and do a breast lift or a breast augmentation or even a breast reduction, and yet they won't invest in the skin of the neck and décolleté region. And the whole point of of getting your breast enhanced or restored is so that you feel better in your clothes, that you can wear things that come down maybe a little bit further than they did before. So this is an area we definitely want to treat. And the cheeks, we're able to really improve the quality of the skin. Again, you see that radiance and that light in these after photos, which is so, so very, very important. The brown has been removed. The brown, while we think freckles might be super cute, unfortunately, over time, what happens is it creates a cloudy complexion, right? It's not clear and bright. As we age, many of us suffer from having more vascular dilation in the skin, and we can see these blood vessels, right? And so it creates a redder complexion, also very common in rosacea. And one of the things that we can do specifically is target these vessels. And while it takes a few more treatments than just our quarterly BBL, this is an area that we're super focused on targeting these vessels so that that redness is cleared up and the skin has a much better complexion. Again, there's one treatment addressing redness of the cheeks, the nose, the forehead, and a significantly improved result afterwards. When we're looking at brown, again, I think brown is one of the things that really does age us, not only on our face, but also our neck, décolleté, and hands. And you can see how removing that brown overall gives her a much better shine to the skin. We have to understand these deeper lines and wrinkles are definitely going to need to be addressed in the future if she desires that, and this will be addressed using HALO Hybrid Fractional Resurfacing, which we'll get to in a minute. And the surface of the hands, like I said, the last thing you want to do is have your facial skin looking amazing and you go to pay for something, or you're at dinner and you pick up a glass of wine and your hands are spotted. We don't want that for you either. And that's why we really pay attention to this area as well. So why is consistent BBL important? Well, this is where we come in with Forever Young, because what we see with consistent treatments is that the skin overall looks healthier after consecutive treatments. That is the key. There's less hyperpigmentation, less red discoloration, a more even skin tone, and this is 7 years of consistent treatments. When we look at 11 years and 32 treatments later, she clearly doesn't look 10 years older or 11 years older. She looks either the same age, 38, or slightly younger. Her skin is clear, her skin has less freckles, less sun damage, less discoloration, and overall looks younger. This is absolutely remarkable. Well, why does this happen? Well, a retrospective study looked at specifically 11 patients that were treated very consistently over 9 years. And they noticed that all of these patients appeared to have defied age. All of these patients looked 10 years younger than their actual age. And Stanford then said, well, why is this? Is something happening with these cells? Well, we looked at aged, damaged, untreated skin cells. The top area here where the green is means that these genes are on. And if we go over here to the young, untreated, less sun damaged skin cells, all these genes are on. Well, we know younger skin looks healthier almost always as compared to us as we move into our 50s, 60s, 70s, and we not taking care of our skin. We've been exposed to the sun over decades. We know that it doesn't look quite as good as it did when we were in our 20s. So why is that? Well, when we expose these cells to broadband light, we see that many of the genes that were contributing to this older factor or this older appearance have been turned off. And many of the genes that were turned off before are now turned on, mimicking that of a younger skin cell. And why consistent treatment is important, because consistent treatment is going to keep those younger genes turned on and manifest as brighter or radiant skin. So here are the key takeaways for BBL. We firmly believe that treatments need to be 2 to 4 times per year. We know this delays the emergence of visible light signs of aging, and we also know that this activates youth genes in our skin cells, according to the Stanford study. The benefits are the same for all patients across all skin types, and that's a radiant skin tone. That's clarity of the skin, pore size reduction, and smoothness. It delays the development of wrinkles and skin laxity. And this is why we're so excited to share BBL with you today. I'd like to change gears here for a second, let Dr. Antunes take over. He's going to really explain what HALO Hybrid Fractional Resurfacing is.
Thank you, Dr. Piazza. So HALO is a very different technology than BBL, although is a complementary technology. As a matter of fact, a lot of patients, they do HALO and BBL treatment even on the same day. So what is HALO? What is a hybrid fractional laser? So as we can see, the hybrid portion of the laser means that there is on the same area of the skin at the same time, there is two types of lasers delivering treatment to that one area. And then the fractionated portion means that we're leaving areas of the skin that are untreated. Basically, they're left intact. And this is done with a remarkable handpiece that's we're gonna show you guys a little video of how that's gonna be delivered to your skin.
HALO works by using two laser wavelengths to synergistically repair and rejuvenate your skin. The new integrated cooling system helps cool the skin during the procedure to make it more comfortable. Constant temperature monitoring of the skin ensures a safe and more accurate treatment. One laser targets the epidermis, the topmost layer of the skin, to reduce pigment and restore your glow. The other laser targets the dermis, the bottom layer of the skin, and removes years of sun damage from deep within.
Great. So let's talk about a little bit about the hybrid portion of the laser. So we can see here a picture of a cross-section of the skin. So what we're looking at is all those little purple dots on this photograph are the skin cells. The portion on the top where it's like a darker purple, that's the epidermis, that's the surface of the skin. While the deeper portion, that pink area, is called the dermis. So one of the lasers, the lasers on the blue box is basically confined to the epidermis. So that's gonna affect the surface of the skin. While the other laser is going to go deeper into the dermis, creating changes there. And those changes are basically going to be the production of hyaluronic acid, elastin, procollagen, and collagen. So when I'm thinking about what is this laser or this two lasers doing, I think about two things. One, they're polishing and resurfacing the epidermis. So that's where we're getting rid of fine wrinkles, smoothing out the surface. And secondly, they're creating a thin coat of what will be equivalent to an HA filler deeper on the skin that will later be replaced with your own collagen and elastin. So that's like what the hybrid portion. So why is it important to be fractionated? So the fractionated is we're treating an area and then we're leaving a part of the skin untreated. Why does that matter? It matters because that untreated area of the skin, it will help the treated areas to heal faster, which is why HALO delivers phenomenal results while having really low downtime. So they have about 2 days of redness and about 2 or 3 days of peeling. So as we can see on those photographs, those are patients that are photographed before getting treated. They're different aging processes, different skin types, and they're going to be treated with different intensity of the laser. So this is day 0. On the next day, we'll see, a little bit of redness. The patient on the right got treated a little bit more aggressively. She's a little bit more red than the other ones. And then we can see a couple days after that, which will be day 3, all of them are starting to peel and they're like on a way to a full recovery in another couple of days or so. So this is why the fractionated portion of this treatment is important, because it allows the treatment to be effective while having a low downtime, which is pretty unique in the world of lasers. So let's take a look at some results. So here's we have a patient, relatively young on the spectrum, and she had 1 treatment of HALO, and this picture on the right has been taken 2 months after her treatment. We can see, even just like taking a step back and looking at it, we can see that the picture on the right almost looks like it's been photoshopped. It looks brighter, it's smooth, it's just beautiful, and this is, keep in mind, all those photos are very standardized. You see they have that chin, they put in their chin and their forehead, and the light is always the same. So it's really important for us to really understand what's effective in here. If we take a closer up on this patient's cheek, then we can see even better. You see here on the left, those brown spots close to the ear, some of the texture changes on the skin close to the eyes and the mouth. And then on the right, substantially better, really, really improved. Again, and you can say, well, maybe this is a younger patient. So let's take a look at what HALO would do for an older patient. So here we have a patient with a little bit more advanced aging. We can see on the left a lot of textural changes, a lot of fine lines around the mouth, a lot more pigment, larger pores. This patient was treated with 2 HALO treatments, and those 2 treatments were done 2 months apart. And the picture on the right, we can see it's 2 months after that second treatment. And the result to me is just really, really remarkable. I mean, this patient looks amazing. Her skin is brighter, is healthier. And when we take a close-up on her mouth, look at the difference around her fine lines. Really, really impressive. No fillers. And again, those treatments were 2 treatments of like 5-6 days of recovery each time, and that was it. So really, really remarkable. Another thing that the HALO is going to improve upon is pore size. So we can see this is that same patient. Now we're doing a little zoom on her cheek. And you see on the left, I mean, you can see the pores large all over the place. And then on the right, it's almost like we got an eraser and erased them, you know? Really remarkable improvement, again, just from 2 treatments with HALO. How did that happen? It happens because as that laser hits the skin and you produce your own collagen, your own elastin, your own hyaluronic acid, you're basically squeezing out those spores and improving the texture at the same time. This machine is called the Visia scanner. That's what it takes all those really cool pictures. It has a tracker that actually can track the amount of pores. So you can see the pores on the left, so it counts. And then on the right, I mean, it's obvious the amount of improvement and the amount of reduction on the pore size. So really, really cool feature of the HALO that's treated, you know, for patients that are just concerned with large pores. So another patient with a little bit more advanced aging than an initial one. So again, a lot of different problems with pigmentation, textural changes. Again, this patient also was treated with 2 HALO treatments. This picture on the right, again, 2 months after the second treatment. Again, really remarkable improvement on the texture and also on her pigmentation. We can look at all the brown spots that are gone. And another feature of the Visia scanner is that we can actually take the pictures and look with a UV filter. And that is, we're looking at pigmentation that's a little deeper on the skin. It's not really quite visible yet, but it's present, and this scan allows us to see. So this is before the HALO, and then after 2 treatments with HALO, a remarkable improvement. As you guys can see on the picture before, this is just the scanner showing the amount of improvement. So a lot of browns or dark spots on the left, very few on the center. And as a matter of fact, when we compare this patient with a patient that's 26-year-old, we can arguably say that she is actually better, you know, in terms of the improvements on her UV scanner comparatively to the 26-year-old. So really, really remarkable results from the HALO treatment. Another thing that the HALO, I believe, is really unique is the treatment of melasma. Melasma is a very, very difficult problem for people who suffer from it. They know this is a very difficult thing, particularly in Texas, when we have a lot of sun, a lot of heat, you know, very, very hard to get control. And HALO is one of the, in my opinion, one of the better treatments for melasma, avoids using a lot of the oral medications and their own side effects. And we can really keep melasma under control with HALO. Of course, you know, there's a lot of other precautions, but you guys can see on the photograph here, this patient with pretty severe melasma on the left has a really remarkable result on the right. So you guys can see very versatile treatment, you know. So what are the takeaways of the HALO? So normally we recommend 1 to 2 treatments per year. And again, it will depend on the person. And sometimes the first treatment, we would recommend getting it 2 treatments like we saw on those 2 patients. And those will correct signs of aging with very minimal downtime because of the ability of the fractionated and also the properties of that very cool handpiece that the Cyton designed. The handpiece also allows the benefit from patients with all over the skin types, you know, so patients with a little bit darker skin, which have been told that they're not good candidates for lasers or chemical peels because there is a risk of hyperpigmentation, they become better candidates to be treated with the Cyton technology because of the way they design their handpieces. And then across all ages are able to build collagen, elastin, hyaluronic acid, and therefore improving the skin texture, reducing wrinkles, fine lines, correction of that pigmentation problem, and again, the bonus of reducing pore size, which all of us would like to have as well. So I will transition back to Dr. Piazza, and he was going to give us the icing on the cake with this really, really remarkable skincare product with a really cool technology. And I'll put it back to you, Dr. Piazza.
Thank you, Dr. Antunes. So what I want to talk about is Elastin Skincare. This is actually a new player to the marketplace, but has actually been around for about 5 years and has been being watched at very closely because it's been one of the fastest growing skincare companies for the 3rd year in a row. And why is this? Well, they're a science-based company. They've created a product, skincare product that has Trihex, or incredible protein technology that allows us to do lots of different things with your skin. If you think about your lawn for a second, we're going to say your lawn is your skin, right? And you think about, you want to fertilize your lawn. You want to do a treatment to your lawn or your skin. You wouldn't do that treatment or fertilize it if there's a whole lot of weeds, right? So you want to weed the yard, then fertilize the yard. And so when we think about that, we think about this, because this product basically does that. It's going to get your collagen and elastin boosted and in line. It's going to make sure that you're optimized for your treatment and allow you to have reduced downtime, reduced bruising and swelling, and build and boost that collagen and elastin. And it is actually one of the perfect finishing products post-treatment. So what we've done is we've looked at the scientific studies, and here are some slides from that. You saw these skin sections earlier. The purple squiggly line at the top is the epidermis. That's what we can see. Your epidermis is showing, right? And then what everybody says are used to. And then you see that this is thicker after consistent treatment. All the pink down here are collagen. It's collagen bundles. And you're seeing disorganization with it, and you're seeing a very linear, organized appearance. I think what's awesome about this is that there's a precursor to collagen, and that's called procollagen. So this stain, brown, is looking at procollagen. And we want to know, is there more procollagen, meaning more new collagen formation, occurring with the use of this product? The answer is yes. We see an abundance of brown pigment after consistent treatment for 2 weeks with this product. What about elastin? Nobody really measures for elastin, at least it seems like it in our research. And we notice that there's a significant increase in the amount of elastin produced with consistent treatment. And you notice that these studies are showing 2-3 weeks of consistent treatment. And we love that because if you pre-treat with this product, you're going to have procollagen being formed, you're going to have collagen organized, you're going to have elastin production happening so that you have a better result and less downtime. So if you look at the split space here, one side's been treated with regenerating skin nectar on each of these patients, and the opposite side has not. And you see increased redness, you see swelling and discoloration in both of these patients that are on the untreated side. That's the power of this product, and we absolutely love that it's science-driven with its creation and formulation and how it came to market. Why is all this important that we've talked about today? Because we really can't show you the changes in your skin if we don't have the right tools. We do have a Vizia skin analysis. This is something we ordered back in January. It came during this quarantine and stay-at-home order, and it's now in the office and set up. And we're super excited about it because this is what's going to show your pore size, your skin texture, and the amount of sun damage you have. This will serve as our baseline. It is the gold standard in imaging, and it will allow us to have a comparative analysis for you with where you were before we started your annual treatment program and where we are at the end of your annual treatment program. I think this is a remarkable tool. This is now the 7th generation of Vizia technology, and we're so happy to have this to show you where you are with your skin. We want to be able to create a customized plan based on your goals, but what helps us is knowing exactly where your skin is from pore size, skin texture, and sun damage, something we just can't tell with the naked eye. So our offer to you or for you is this. We appreciate you for watching our webinar today, and we want to create an annual skincare program for you, as I outlined earlier in this presentation. We want to give you a Vizia skincare analysis complimentary, And that's an amazing way to serve as your baseline to show you exactly where you are. We want you to have your first elastin regenerating skin nectar on us. And that's a big deal because we know this is going to improve your outcome. And I don't want you getting your first treatment without you having this on board for 2 weeks prior to your treatment. We also have created a package for you that includes 12 months of treatments. That's one HALO Hybrid Fractional Laser Resurfacing. It's $1,500 is what we normally charge for that. We've reduced it to $1,275 for you. And also a BBL every 3 months. That's 4 in a year. So they're roughly $400 each, which is $1,600. And we've reduced that to $1,360. When we look at this entire annual skincare program package, it's a $3,400 value, and we've reduced that to $2,635 for you. So again, to recap, that's a 22% savings. That's over $750 off. Your investment is $2,635 for 12 months of treatments. And I know this is a hard decision to make. This is a lot of money. We are totally sensitive to that. We wanted to put together a program that we felt would at least give you 12 months of amazing skin changes. And then if you want to think about it, if you want to come see me for a consultation, do an annual skincare program, eval and creation for you, I would love the opportunity to do that.
Thank you, doctors. That was awesome. I don't know about you all. I've seen this presentation a few times, but every time I see it, I want to call right away and schedule my BBL and halos. So keeping that in mind, if you do make the decision to take advantage of this amazing offer, we are going to extend first appointments to those of you who decide to do this when we open back up. So we're expecting some lines in our appointment calendars. So that's kind of a nice little perk too. So we'd be happy to open up those first appointments for you if you decide to take advantage of this annual skincare program. So I want to move into some questions, and I'm going to bring the doctor's video up so you can see their very nice faces. There's Dr. Piazza. Okay, so the first round of questions, I'm seeing a little bit of a cluster around what does it feel like? Dr. Antunes, do you want to take this one?
Sure. I think, well, I always tell my patients, it depends on the person. Like I'm a wuss. I have a very, very low threshold for pain. Most people actually think that BBL doesn't hurt at all. I've heard even that says that they feel comfortable, you know, doing BBL. It's actually a comfortable feeling. HALO stings a little bit more. For BBLs, typically we don't put anesthesia, but for HALO we do it with topical anesthesia. Patients like me, we can offer nerve blocks if that's the case, you know, for patients that have a little bit more sensitivity. But overall, all in all, it's a very well tolerated treatment. It does not require like nerve blocks or deep or oral sedation like some of the other a little bit more aggressive lasers like erbium or CO2 and so on. So all in all, I would say that it's a pretty mild and tolerable procedure.
Great. So I've got another question here for you, Dr. Piazza. Is it safe to do these treatments in the summer? And if you do, what is the downtime for sun exposure?
That's a great question. So yes, it's safe to do these in the summer. No, it's not safe if you've been aggressively tanning and sunbathing and you have a significant amount of inflammation related to that choice. I think that, going into the sun is not a problem. Wearing protective sunscreen, taking care of your skin, not getting sunburns, not going through the whole blistering and peeling phase is absolutely required if you're going to proceed with BBL and HALO. I did my HALO treatment and BBL combined treatment in the fall of last year. And, in Texas, it's hot in the fall. And so, did the heat make it a little bit more intense for me just that first day? Yeah, but typically those intensities last 2 hours. And then after that, after HALO, 2 hours after your HALO, it's all of a sudden the intensity goes away. And I have a whole video series on my experience with this, documenting it, day by day. And we'd be happy to send you that link. Allison, just make sure you let us know if you'd like us to send it to you. We'd be happy to do that. So, I think it's absolutely safe to do in the sun. It's not safe to do if you are getting sunburned constantly. So protect your skin. That's my biggest piece of advice, regardless of whether or not you do HALO or BBL.
Great. So, Dr. Antunes, could you maybe talk to us a little bit about the downtime again for both of these treatments?
Yeah. So BBL really doesn't have a downtime. You may be a little red right after and perhaps for a few hours after that, but all in all, there's typically doesn't have any downtime. HALO, most people who have downtime again of like around the 5-day mark. Like some people is a little bit less, some people is a little bit more. It depends a little bit of how much we do it, and we always ask, if the patients have any time constraints, because one of the beauties of those treatments is they're very much tailored. I can do a treatment that is still very effective, but it's going to have a shorter downtime. But if you say, you know what, I have nothing to do, go to town, we can be a little bit more aggressive, get maybe a little bit of an edge on the result with a few more days of recovery. But all in all, I wouldn't say it's less than a week of downtime. And I'm saying that downtime means like from treatment to makeup, ready to go out.
Yeah, so Jen was, for my treatment, Jen went in the 30% kind of fairly aggressive or super aggressive range. And I had about 4 to 6 days of what you would consider social downtime. For me, I still went to work, operated, saw patients, but I had to be in an event on Saturday night in Austin, and it was a black tie event, and I felt completely confident going. All of those little peelies that you saw day 3 that showed up on those photos that Dr. Antunes went through were gone, and my skin actually looked amazing. So, I think this is something you can do and still have your obligations on the weekend if you did this early in the week.
Perfect. Now, Dr. Piazza, I know you are super excited about our Elastin products, and I've got a couple questions around those. Can you use Elastin just year-round? Can you use it on other parts of the body, or is it face only? And we know we want to start it 2 weeks before the treatment. And how many times a day do you use it, and for how long after your treatment do you still want to stay on it?
Great question. So there are actually 2 products that we, Dr. Antunes and I, really fell in love with. One is the Regenerating Skin Nectar, and the other one is the Transform Body. And so yes, you can use this other parts of the body, and each formulation has a specifically different for what we're trying to achieve with that. So Regenerating Skin Nectar, predominantly used for face, neck, and décolleté. It can also be used in the back of the hands. This is your pre-treatment serum that is for resurfacing BBL and things like that. It's used twice a day. It's typically 2 pumps twice a day. With regards to Transform Body, this is really going to work on skin tightening of the body. This is also going to work on adipose cell reduction just deep to the skin. And this is a perfect treatment to combine when you're doing things like cool sculpting or cool tone, when you are having liposuction, and you would retreat the area a few weeks prior, so that change that you're going to go through, so that when you have the fat reduction or you have the muscle toning, you are able to really rebound from that and get an even better result. So absolutely, we love both of those products, and we have both of those products in the office. And
do you use Elastin Nectar for pre-treating HALO and BBL as well, or just HALO?
Correct, pre-treat and post-treat.
Okay.
For both BBL and for HALO, whether they're combined or separate procedures. And typically, I saw a question pop up about BBL. How often would you do this treatment? Typically, it's about 1 treatment every 4 weeks, and we have a couple different protocols, but one of our protocols is what we call the sun damage reversal protocol. And so we'd be essentially treating you with 3 back-to-back BBLs 4 weeks apart, and then go right into maintenance. And so for those sun worshipers out there, you know who you are. Got a lot of hyperpigmentation, starting to see the skin starting to get crepey. This is really the best treatment protocol when it comes to helping to reverse that sun damage that's there. And And like Dr. Antunes said, the downtime or social downtime for BBL really is none. You get a little bit darker from us targeting the hyperpigmentation or that sun damage, but that typically goes away within 5 to 7 days.
Perfect. So this one is for you, Dr. Antunes. This is a great question. Talk about the differences if someone doesn't want to do the whole package and do both HALO and BBL. Do you still get a lot of benefits from just doing one or the other?
Of course, yeah. Many people, they have like no ability to take downtime, and they just do the BBL series, and then they don't get on the BBL maintenance. And as we saw in the presentation, you know, it's really reversing what the gene expression is doing on the cell. So of course we're going to see benefits just from a BBL. The HALO and the BBL is just like that complement that one technology is going to give to another one. So it's all about how much time and people's different budgets, you know, and what they can afford and what they were willing to do at one time, or sometimes even the fear factor. But they can, if you do just a HALO or just a BBL series, you're obviously going to see a benefit. If you want to get the most benefit that you can, I would recommend doing both.
Perfect. And what about the time separation between all of those treatments?
So I saw a question also pop up. I'll cover that as well. Do we recommend separating the BBL and the HALO treatments? It depends. So it depends on what your goals are and what we're trying to achieve for you. Sometimes combining BBL and HALO at the same time can generate a little bit too much heat in the skin, and it is going to be basically not really what we want to do with regard to your treatment. We worked hard, in selecting this technology because it reduces the temperature of your skin. And we know that we can have better effect if we're not overheating your skin and stimulating more inflammation, which creates more downtime and more pigmentation. So it all depends on what your skin type is and what's the problem that we're trying to treat. We can very routinely combine BBL and HALO. We can also separate them. The procedures run different time lengths. Typically, BBL is about a 20 to 30 minute procedure. HALO, we usually reserve about a 40 to 50 minute time slot for that procedure. I think that when you're thinking about doing these, it depends on the protocol. So typically one HALO is recommended once a year, up to 2 times a year, or sometimes 3, depending on what we're trying to achieve. Again, it is the best laser available that has the shortest amount of downtime and the biggest bang for your buck when it comes to skin treatments. BBL is totally different. It is your gene expression pathway, right? It's the one that's going to turn on those forever young genes for you. And this is something that gives cumulatively, right? So the more treatments you get, the better that's going to be. And we recommend at the very least 1, 2 a year. We really like our patients to be doing this once a quarter, so every 3 months. We also feel that there are advanced protocols that we have for BBL, whether we're treating rosacea or acne, or whether we're treating melasma. Those protocols are slightly different and will increase the frequency of treatments needed based on what our targeted outcome is, which we measure with Vizia. So your photographs are always consistent. The lighting is absolutely the same. The head position is absolutely the same. And that's what the beauty of that technology is. We're so happy to have that.
Yeah, really important point on bringing up the acne portion. BBL is a phenomenal treatment for acne and for the maintenance, actually, of patients who are prone to acne. So really good remembering bringing that up.
Someone else asked about milia. Would that fall in the same category?
No, I wouldn't say that milia would fall in the same category. Milia would be, I would say milia, you'll benefit more from like an exfoliation type of treatment. You know, I wouldn't say that, I wouldn't use HALO to treat milia. You know, I would use more like exfoliation type, you know, or, you know, some of the medical grade skincare, not like the exfoliating masks, you know, that you get off of the internet, because that can be too aggressive, but see an esthetician, get a treatment plan, and I think just skincare alone will treat milia before committing to a laser.
right? And doing other skin treatments like hydrofacial, exfoliating treatments that are really going to do a deep cleansing will help us to get that resolved.
We had another question about with this offer, if the laser could be used on the neck as well.
Yes, the laser absolutely can be used on the neck and the décolleté. That is and that's what we are most interested in treating collectively, the face, neck, and décolleté. So this offer includes face and neck for HALO. BBL is face and neck. Décolleté is typically another area. It does require us more time to treat that area. And so, the package would be altered just a little bit, but we'd still maintain the same percentage of savings for you if that's something that was really interesting to you. Absolutely.
Yeah, and this has to be limited because from a safety perspective, if we're applying anesthetic on the face and on the neck, and if we would extend that to the décolleté, it could be a higher dose of anesthetic than we would like. So that's why some of the time those treatments are spaced out.
Perfect. I think we have time for maybe one or two. I see a question about the difference between HALO and BBL and resurfacing. Do you want to address that, Dr. Piazza?
Sure. So BBL is not a resurfacing treatment. It is a light therapy. It's a light treatment. The precursor to BBL, which we didn't really talk about today, is IPL or photofacials. And you probably still see these popping up on Groupons. This is an older technology. We still actually have an IPL machine and we can't even get rid of it. Nobody wants it. So BBL is the current therapy. It's recommended for your skin. And it is not a resurfacing treatment. It is a light energy that breaks up brown pigment, destroys the redness or the increased blood vessels or vascularity of the skin, increases collagen production, hyaluronic acid production, and this reverses the way your cells are functioning from a genetic code standpoint. With regards to HALO, this is resurfacing, and it's a hybrid fractional resurfacing. It's two lasers at the same time happening simultaneously, targeting the superficial epidermis and the deeper dermis at the same time and treating in little columns so that you have normal skin around it. And the reason why that works in our advantage, as a huge advantage for us in recovery, is because you have normal skin that's going to help to heal the area where we've created that damage, that very controlled, precise damage to stimulate collagen and elastin. And so you rebound super quickly with regards to your healing time and just have outstanding results. Traditional resurfacing lasers were hotter. They were more or fully ablative, which means all the surface of the skin was completely demolished. And your downtime typically is 10 to 14 days. We have this technology in the office. We can definitely do that. And it is sometimes the best way to treat really deep lines around the mouth, really coarse wrinkles of the face, and it is an outstanding treatment. But not many of our Texas patients want to give up 2 weeks to get this treatment done. And a hybrid fractional resurfacing laser allows you to have that 4 to 6 day downtime versus the 10 to 14 day downtime.
Perfect. Well, thank you, doctors, and thank you so much to everyone who joined us today. We honestly really appreciate you taking the time to spend a little bit of your afternoon with us. There will be an email that goes out to all of you tomorrow. We did record this, so we'll also send the recording. We'd love for you to share that with a friend. Invite them to watch the video or give us a call if they have questions. And certainly respond to that email. Will come straight to me with any other questions that you have. I know there's a lot of common questions about when will we be open. We don't have the exact answers for you yet, but we are working on them. And as soon as we know, we will be in touch for sure. So thank you all so much again, and I hope you have a wonderful rest of your day.